first nerve is the olfactory nerve. Testing is rarely required in pediatric exams unless the child complains of loss of taste or loss of smell, or has a visual field defect, or has a frontal tumor, or has had surgery. Basically, the idea is to just offer not a very unpleasant smell, bring it from, say, the periphery. And in pediatrics, we would prefer smells like vinegar or mint. You just bring it from the side and then ask the child if he smells anything new. And that's fairly straightforward. So the olfactory nerve is just a question of offering a smell and the child telling you whether he or she can pick it up. And that's the olfactory. The second nerve is assessed in three areas. First, you want to know the visual acuity of this child. That is how acutely how this child sees, and that is tested by standardized instruments. So you can have the Snellen chart, you can have the Steiker chart, or the Songsen-Silver test, and these are for visual acuity. The next component of the second nerve test is visual fields, and this is an important test in pediatrics. And the idea is to bring either a bright little pin or an object from the periphery, and where I ask the child to see that so the idea is that you bring either a bright object or a pin, or even your wagging little fingers from the periphery, and you ask the child to respond if he sees your fingers. So as your own fingers come into your view, you expect the child to also respond. So you do with one eye, and then you come and do the other eye. And then you determine what kind of visual field defect this child has. We have different types depending on what you see, whether you call it the bitemporal hemianopia and things. We shall not go into that detail. The third component of your second nerve examination is fundoscopy. And we expect medical students and postgraduate students, for that matter, always to look at the back of the eye if you can get a chance. So fundoscopy involves also getting down to the level of the child, and usually if it's your right eye you're looking at, using an ophthalmoscope in your right hand, you attempt to look at the back of the child's eyes, and that is a bit of fundoscopy where you want to document whether there's optic atrophy, papilledema, or anything else, a cherry red spot, or anything else that you may find. These are the three important things you may pick up from fundoscopy. And that completes the second nerve. The third, fourth, and sixth nerves control eye movements, and that is the next system to examine. Pulses of these nerves are not too common, but they are very important to recognize. Important causes of pulses of these nerves may be following meningitis, that is post-meningitis. In pediatrics, the most common cause is cerebral palsy. They also follow tumors in the brain, and it may also follow Guillain-Barré syndrome. So these are usually the causes of pulses of third, fourth, and sixth nerves. A pulse of the third nerve is very important, and usually the eye is said to be deviated, is down and out, and on the side affected, the pupil may appear normal or larger than normal. That would usually demonstrate third nerve palsy. So this eye may fall down and out, as we say. It may just lie at this corner. The pupil may be normal or larger than normal,